Welcome, ladies and gentlemen. My name is Josh Englehart with the Branch Hillsdale St. Joseph Community Health Agency, and I am coming to you today with a discussion regarding THC and pregnancy. And I'm also joined with Kaitlyn as well, who's going to provide some information, some education regarding this topic. But before we go into that, I will allow Kaitlyn to introduce herself, to tell you what organization she's with, her job title, and all that. So, Kaitlyn, welcome.
Thank you. Thanks for having me, Josh. Yes, my name's Kaitlyn Hite. I'm a family medicine provider who also does obstetrics with Oaklawn Hospital up in Marshall, Michigan. We have outerline clinics, one of them being in Coldwater. Um, and yeah, I've been a family physician for about 6 years now and taking care of pregnant women, their newborns, really cradle to grave patient
Very
care.
Could you discuss some of the possible effects of THC use or THC use with any kind of like THC products and an unborn child?
Certainly, yeah. There have been quite a few observational studies, meaning they looked back at women who had chosen to use marijuana during pregnancy, and they looked at potential effects on the fetus and the newborn. Um, so what they found is that those pregnancies, they're higher likelihood to need NICU admission, so admission to a neonatal intensive care unit after being born. Those infants typically will have lower birth weights,
Okay.
and sometimes they are at higher risk of preterm delivery, so delivery before 37 weeks gestation.
Okay. Do you deal with one of the things that has been pretty prevalent in these videos that we've done is we've talked about the stigma of marijuana, stigma
Mhm.
of THC. Obviously, that stigma is kind of diminishing, especially with the legalization of it as well. Um, do you find with, any of your patients that there maybe is this sense of marijuana isn't that bad to use or THC products aren't that bad to use when they're pregnant? Like at least it's not maybe as bad as other drugs or drinking or anything like that?
Mhm. Certainly, it's viewed as because it's plant-based, it's natural,
Hmm.
and it must be safe since it's natural.
Right.
And also since it's legal, particularly here in Michigan, they kind of feel like they have the stamp of approval from the legal system as well to say that this is okay to use. And the two most common reasons that I find patients tend to reach for THC products is anxiety in pregnancy and morning sickness or nausea. Um, but what I try to drive home to my patients early in pregnancy is that there's safer but still natural treatments available in pregnancy than THC products.
Right. So, in one of the conversations that we've had with this campaign in THC and mental health is this, once again, this idea that using THC products, using marijuana will help in regards to what you just said, like anxiety. Um, and the studies are showing that individuals that are utilizing THC to help deal with anxiety, with the levels of tetrahydrocannabinol being so much higher now in these
Hmm.
products, that
Yep.
it actually promotes anxiety all the much
Hmm.
more. So even maybe during that time where they are under the influence, they may feel a sense of euphoria or relief or whatever the case may be. But then once
Hmm.
that wears off, kind of their baseline overall changes and they become more anxious than what they were.
Yes, certainly. That definitely happens in pregnancy. And related to nausea, a similar type of effect occurs where more use of THC products will cause increased risk of cyclical vomiting syndrome,
Wow.
um, which is, very, very, it's a bad thing to have in pregnancy
Oh
because
yeah.
you need to have your hydration levels and your electrolytes to be, prime when you're trying to grow a newborn inside of you.
Right, 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 right. So it actually can, once again, so you're looking at another element that there's a
Yeah.
belief that by taking it, I am alleviating some of these issues when in actuality it can exacerbate some issues. Is that what you're kind
Right.
of saying?
Right. And it's tough, because the patients do feel good when they're under the
Oh yeah,
influence.
definitely.
But it's looking at the scope, the whole picture, and 10 months of using that type of thing can make your problem worse over time.
Exactly. So, what are some of you spoke about like under birth weight and things like that? What are some of the issues that, a developing child is looking at when it comes to brain development and things
Hmm.
like that when a mother is using a THC product or smoking marijuana during the
Right.
pregnancy.
So what we do know is by taking a substance like THC during the development of a fetus, the development of a child, it targets the cannabinoid receptors in the
Hmm.
brain. And so when they're exposed to things like THC, the fetus, the developing neural system, the nerves and brains in a baby are not able to develop that system correctly, that cannabinoid system.
Hmm.
And that has effects on things like sleep regulation, mood regulation, memory, higher cognitive functions like language and attention span. So the studies they've done on children and adolescents that had mothers that did use THC products, either pregnant during pregnancy or breastfeeding, it shows that there's a higher likelihood of issues with those things like attention and memory, language functioning.
The misconceptions, once again, we kind of just hit on it a little bit ago. Can you go ahead and kind of just talk about maybe some basic overall popular misconceptions that you see with parents or with, pregnant women that are using marijuana? Like you said, you already mentioned something about it being plant-based. You said that they
Mhm.
think that it helps out with anxiety and even maybe like
Mhm.
morning sickness. Is there any other misconceptions that you come about or that you've heard during your practice?
Yes, unfortunately, there's a large misconception that, if my doctor knows that I'm using THC or marijuana products, then my kid's going to get taken by CPS, or I'm going to have a
Mhm.
CPS, Child Protective Services investigation against me. So there's a lot of fear in even disclosing use, but it's not to be punitive on the parent or the person who has exposed the child. It's one for the safety of the child, but two to also identify individuals that may need help or may need substance use
Right,
treatment. Um,
right.
and I have not in my time here in Michigan so far seen CPS take a child because a mother was using THC in a reasonable, case. But they do the investigations, and sometimes they'll come to the house and talk about, keeping those products locked and away from the children and
Mhm.
test the safety and things like that.
Are there any other misconceptions that you've come across that you can think of?
Oh yes, the other one would be that consuming THC products, like edibles, is better than smoking them.
Ah, really?
Yeah. Which it is for the lungs, and
Right.
for the individual using the substance, it's better to consume it than to smoke it and have that damage in the lungs. But the fetus inside the mother and or the infant nursing at the breast, it feels the effects the same,
And that kind of
right?
leads me into the last question here as well. Um, can you kind of break down and explain you can misconceptions, dangers, and all of that with a mother that is using THC, smoking marijuana while breastfeeding a child?
Hmm. Certainly. So just from the baseline, if they're smoking, that's the same as if you were smoking nicotine. It
Hmm.
puts the child at higher risk of respiratory illness and ear infections. And we've known that for decades now.
Right.
So that's just in smoking. In using THC substances, it does come through the breast milk. THC is very fat soluble, so it likes to go into fat, so in the fat of our body, but also in substances like breast milk, which is very fatty.
Hmm.
So, the estimation based off the studies is that there's about a third to a tenth of the dose that is consumed or smoked by the mother that ends up in the breast milk.
Oh, wow.
You imagine the infant is much smaller than a third
What?
or a tenth
Right.
of body size.
Right.
So it's quite a large dose for that
Yeah.
infant. And in the same way, our nerves and our brain is not, they're not fully developed when we're born. So that cannabinoid system in our brain still needs to be developed. And so in the same way that it's, hijacked,
Hmm.
in the same thing when they're breastfed.
Is there anything else regarding this topic, THC, pregnancy, in your time, your practice that you feel like would be significant or pertinent to mention for our audience? Just even if you could give a general heed or warning or encouragement to people that may watch this, that let's say they're pregnant or they're maybe considering getting pregnant, but they are a marijuana THC user, what would you say
Mhm.
to them?
From my perspective and what I do, I would just encourage any woman who is childbearing or looking to be childbearing to just find a practitioner that they truly trust so that they can discuss these things with them. And if they are struggling because there is an addictive quality to marijuana substances, if they're struggling and quitting, just know that they can get help.
Hmm.
They to ask and be willing and open to try what their practitioner tells them to do.